This video is dedicated to discuss Botox specifically used for headaches or migraines. We all know Botox is used very effectively for wrinkles, for long-term prevention, and we have a lot of other videos on that subject. But I want to focus on one topic, which is Botox used for migraines. First of all, Botox is very safe. There's a lot of argument that Botox, oh, I don't want to use it because it's unsafe. Well, it's been around for 50 years. To me, it's one of the safest products out there. And it can very effectively treat both migraines and wrinkles, sometimes simultaneously or separately. So let's talk about it. The core issue that makes it very easy to determine if you're a good candidate or bad candidate is a simple question I ask my patients. Is the headache coming from outside in or inside out? What that means is the headache starting on a focus somewhere on the scalp and then moving inside the head, or is it starting somewhere in the brain or way deep inside and coming outwards? Botox works on the outside components and stops or aborts that movement going into the brain. But if the focus or the start point is somewhere inside, then Botox in general can be less effective. Obviously, every anatomy is different, and you may experience, you say, Dr. Lamb, I have no problem with that. I go from inside the scalp, I have a headache that starts way deep and it comes out and my Botox works for it. Great. I'm not telling you that it will work or won't work, but in general, the principle is if it's starting from outside to in, that Botox can be significantly more effective for migraines. Certain areas that you need to treat in a symmetric fashion because it's an area where you don't want to look irregular is here. So the focus starts here, here, or here. This zone right across here, usually in the center, you can't treat it with just doing one side or the other because otherwise you will look weird. So this is the area where I alluded to earlier, which effectively treats both wrinkles as well as at the same time treats the migraine. So you want to treat it as if you were treating wrinkles in a pattern that would be effective for migraines as well. Now, in the temple or the occipital region, which is back here, those areas, what I do is I ask my patients specifically take one finger and point to the area where the problem is. And then I charge according to how many areas we need to treat. I've treated for my wife, I've treated for my staff, I've treated for my family, I've treated for countless number of peoples, and it truly is a very effective way to abort the process of migraines. Why does it work well for migraines? We don't really know. It could be the fact that the muscle's not spasming. It could be the fact that there's some vascular, which is a fancy medical term for blood vessel, cutting down the spasm. It could be the nerve, sort of a nerve trigger point. Botox works extremely well to stop nerve pain. So all of these things, we don't know exactly how it works, but it does work extremely well. Sometimes for patients, after repeated dosing, they need fewer and fewer injections, and over time that may last longer and longer. I certainly cannot guarantee that. It depends on the severity of the migraine. Also, I cannot guarantee that you'll have no migraines. But this is a simple video just to give you some broad strokes in terms of what I usually say during an initial consultation for someone who's interested in treating their migraines with Botox.